Dr. Martinez, I'd like you to talk a little bit about, here we are, right? I would like you to talk a little bit about the first teeth, the baby teeth versus the permanent teeth, and the due attention which maybe both of them should be getting, because there obviously here and there seems to be a little bit of a feeling out there, especially now when economics are a little bit tough, and like we don't need to be taking care too much of the baby teeth because after all they get replaced, and so what? Can you shed some light on that thing a little bit?
Sure. It is my philosophy that obviously children require just as much attention as any adult requires of their teeth. I believe there's really no difference. I mean, teeth are there to serve a purpose and a function on children, as well as the purpose and function they serve in adults. And we always think and we underestimate children, and we think that they don't really care if their front tooth is black. But I believe, and from what I've seen in my office, children do care what they look like. Children do care if at 3 or 4 years old they're missing only one tooth, and none of their classmates are missing those teeth. Also, when you're not taking care of these teeth on children, and they have a cavity, let's say, and they're not getting the treatment done in the cavity, this cavity can potentially become, and will become, a bigger cavity, potentially become an abscess. And then you're talking again, we go back to the issue of treating patients where you're already treating kids to pull teeth so their experience with the dentist already is not a very positive one. I believe that treating children could be fun, could be actually very rewarding, and should be a fun experience for children. It should be a cleaning every 6 months, fluoride treatment every 6 months, going over what they need to be doing as far as brushing and flossing. I always tell parents, they're too little, floss their teeth for them. I have a lot of wonderful parents that are very in tune to their child's needs, because they tell me that when they were growing up, their teeth were just terrible, and they don't want to have the same experience for their children. So I believe it is just as important to treat your children as it is to treat the adult dentition.
Okay, here we have it. So definitely important to take care of the first teeth. And I think also you can, when you do that, when you take care of those baby teeth, you can watch to make sure that the second set of teeth basically can grow perfectly, just in case there's some misalignment, which then might possibly be able to eliminate or at least limit a heavy orthodontic treatment. Instead of many years, it might only be a little bit or even nothing. Is that true also? Yeah. Right.
Parents always ask me that, like, if I would have done something on one of her, could have we prevented this orthodontic treatment? And in reality, yes, you can prevent a heavier load of orthodontic treatment, but it's a blueprint. Once you come in with crooked teeth and you're formed with crooked teeth, your teeth are going to come in crooked. But we can have interceptive treatment done with either appliances or that sort of thing to minimize the need for orthodontic treatment, or possibly minimize the need for orthodontic treatment in the future. So having regular visits, it kind of gives us a blueprint, the dentist, from when they were very little to the changes that are taking place in their mouth, to by the time that they're ready to have some sort of appliance. So yeah, it's very important. Again, we're talking about the prevention, the preventative type of dentistry. Instead of waiting till 13, 14 years old to get any treatment done, where at that point you've already missed all the growth spurts and all the growth that is essential, and you pretty much locked yourself into a full orthodontic treatment for many years.
And that, of course, is, if it can be avoided, it's number one, money, and definitely some inconvenience to the person wearing it. Thanks a lot,
Exactly.
Dr. Martinez.
Thank you.